Okay, we're going to go ahead and get started. So I want to again say thank you for joining us for today's webinar titled Benefits 101. This is Elissa Childless speaking. I'm an Assistant Director of Programs and Policy at Achieving the Dream. As all of our webinars begin, I'm just going to start by going over some of the GoToWebinar technology. In particular, I'm just going to show a few features that allow to make the presentation more interactive. You should see the panel featured on the right side of the screen. This allows you to see who else is on the call and the attendee list. If you can't see this panel, it's because you've minimized your tab. So just click on the arrows, and it should expand the panel pictured on the slide. You should also have the audio pane, which allows you to decide if you're going to use your telephone or microphone and speakers. I will just add that if you cannot hear me very well, please just raise your hand right now. In the past, we've had some challenges with either audio on our side or audio on participant side, so please just raise your hand if you have any problems, or feel free to send me a question using the question pane. You can send questions throughout the webinar through the question pane just below the attendee list. We will be answering all questions at the end of the webinar during the dedicated Q&A section. That's pretty much an overview, but if you have any questions, again, just ask them. So on today's webinar, we have the pleasure of having Amy Ellen Duke-Benfield as our speaker. Amy Ellen is a Senior Policy Analyst at CLASS. Ms. Duke-Benfield's focus is access to and success in post-secondary education and training for low-income students. She analyzes and advocates for federal and state workforce and education policies that better serve low-income students and adults, and provides technical assistance to federal, state, and local advocates and governments in these areas. She also directs CLASS Benefits Access for College Completion Initiative, which seeks to increase access to public benefits and financial aid for low-income students at colleges across the country. Prior to this project, she spearheaded CLASS work around the Higher Education Act and related federal post-secondary legislation, as well as a Title II of the Workforce Investment Act. Previously, Ms. Duke-Benfield was a research associate at the Urban Institute, where she contributed to several evaluations of state-level welfare reform and anti-poverty programs. She holds an undergraduate degree from Swarthmore College and a master's degree from Emory University. So on today's webinar, Amy Ellen will provide an overview of various public benefits spanning from temporary assistance for needy families to earned income tax credits. She will also put this into context relevant to community colleges. We hope that today's webinar will put into context a great overview of the public benefits your college might want to provide as information to students on your campus, which is part of the low-touch service in the second pillar of the WFSN strategy, which is work and income support. So I'm going to give the floor away to Amy Ellen right now.
Thank you, Alyssa, and thank you everyone in the Working Family Success Network for joining today for this primer, so to speak, on public benefits. A future webinar will cover benefits access strategies from outreach and marketing to screening and application to benefit receipt. But we thought that we would start out with just an overview to introduce folks to what the benefits are. Next slide. Just as a brief overview for today, I want to let you know that we're going to talk about who the eligible students are, and that includes students who are parents, who tend to be eligible for many more programs than those students who did not have children. And I'll talk about a range of programs, including food assistance, health insurance, tax credits, programs geared towards families like TANF, and special cases, which fall into another category that we won't get into in detail in here, but I can hook you up with more information if need be, as well as around improving access. There are lots of acronyms and names you might not be familiar with. I have provided Alyssa a cheat sheet, which she's going to send around after the webinar, that includes brief descriptions of the programs and spells out acronyms. This is just a teaser of the sorts of things we'd like for you to think about. Next slide, please. So with income and work supports, there are a range of programs, and you can hit it a couple times with this. More programs will come up beyond TANF, Medicaid, EITC, unemployment insurance, child support, housing vouchers, supplemental security insurance, which is SSI, Social Security, veterans benefits, child tax credit, and Pell Grants. So like the landscape that faces you all and needy students is wide and vast when it comes to potential what we call income and work supports. These include both benefit programs and refundable tax credits, or cash and in kind, and some are means tested while others are universal. In practice, we're mostly going to talk about Medicaid, CHIP, SNAP, TANF, EITC, childcare subsidies today, but if there's something else of particular interest, we can find a way to discuss it. Next slide, please. So you might be thinking to yourself, are students a population that actually need public benefits? And I think it's important to always remember that most of our low-income students are receiving insufficient amounts of aid. Financial assistance programs that historically provided low-income students full or nearly full college expense subsidies are now given simply a component of an education financing scheme heavily laden with debt. Given the rapid pace of tuition rate increases in the past 30 years, and even with the modest increases in the Pell Grant included in the Recovery Act, it would be necessary to more than double the maximum Pell Grant award today to recover the loss in purchasing power of the grant since its introduction. And so what we have right now is a situation where Pell Grant covers really only 1/3 of the total cost that it takes for a low-income student to go to community college. As a result, we see community college students, or college students in general, having substantial degrees of unmet need even after financial aid. For the population that we're talking about, it's roughly $6,000 a year. The more unmet needs students have, the more likely they are to work to fill the gap. And we know that moderate levels of work, like 15 hours or less, is associated with positive post-secondary outcomes, but higher hours of work, especially when students work full-time, have very negative effects. It's also important to note that 48% of dependent students from households earning less than $20,000 per year enrolled in four-year institutions, compared to 66% of students from families earning between $50,000 and $100,000 a year, and nearly 80% of students from families earning between $100,000 and $300,000 per year. You might be saying this, why am I saying this on a call with a bunch of community college students? But it yet underscores once again who the population is that's ending up at community colleges tends to be the lowest income of those who are seeking post-secondary degrees. Then we also have a challenge around financial aid generally not being available for non-credit some workforce classes, and the Workforce Investment Act rarely provides need-based payments. So what we see is sort of a culmination here of a need for public benefits. Next slide, please. So as a result of unmet need, we end up with a situation where students work too much. They are experiencing housing and food insecurity. We used to call that hunger, but now we call it food insecurity. Increased stress, too little sleep, too little time studying, which leads to poor grades. Part-time enrollment, which we know also has a negative implication for post-secondary completion. And all of those combine to lead to the unfortunate outcome of failure to complete. Next slide, please. Many of you might be aware of that survey that happened a few years ago called With Their Whole Lives Ahead of Them. Public Agenda did it, and looked at the main reasons for students leaving school. And what you find here is 71% of students say, I needed to go to work and make money as a reason that they're leaving school. And 52% total say, I just couldn't afford the tuition and fees. So pretty daunting statistics, and point toward us in a direction of saying, well, gee, how can we get more money into the hands of students so that they don't have that pressure to work, they don't feel that pressure to quit school, and they don't feel that pressure to try to balance too many things at once. So briefly, I want to go over a few of the populations that you all deal with, and we can think about that in the context of public benefits. Next slide. Low-income parents are eligible for a wide range of programs. Some programs are limited to families with children, and others are open to childless adults that are more generous or have fewer restrictions. Those that I'm thinking about in terms of being limited to families with children are temporary assistance for needy families, women, infants, and children, which is a nutrition supplement program, and childcare subsidies. Others are open to childless adults that are more generous, for instance, the earned income tax credit, or have fewer restrictions, such as SNAP for parents. Few of those who are eligible for programs receive all the programs for which they are eligible. Some programs have capped spending, so I'm sure some of you have heard in the past about childcare only being available to childcare subsidies only being available to those who are receiving less than $30,000 a year, and so we know that those folks who are making more than $30,000 may have that need, but because of the capped funding level, only a particular percentage of people are available. Or for one of the states that I've worked with in the past, Kentucky, they had such a rule as the $30,000, but ran out of child care subsidy money midway through the year. So the second half of the year, the subsidy program wasn't open for additional enrollment. In addition, eligible individuals might not know about programs. That's something that we've found in benefits access for college completion, or may be deterred by the burden of establishing and maintaining eligibility. Next slide, please. So to talk a little bit about low-income parents, they're most likely to receive the earned income tax credit. I'm sure that most of you have heard about the EITC. It's a refundable tax credit that the lowest income working folks can receive. They're also more likely to receive health insurance for their kids and health insurance in the Medicaid expansion state. If we think of the most recent round of health care reform under the Affordable Care Act, states increased the eligibility levels for Medicaid, and so that led to a lot of low-income parents becoming eligible in those places. That counts for all the states on this call except for Virginia. Those low-income parents probably receive, I'd say between 50 and 80% receive SNAP, which is the Supplemental Nutrition Program, or food stamps, and WIC. And for those who are not in a Medicaid expansion state, so let's say Virginia, there's a 50-50 chance that they'll receive health insurance. Fewer than 50% are receiving TANF, child care subsidies, and housing subsidies. And as I said, part of that is a function of income. Part of that's also a function of take-up in those programs, and people, either them being not thinking that they're eligible, those programs having a stigma connected to them, especially cash welfare, those programs having long waiting lists, which is sometimes the case for housing subsidies. Next slide, please. Low-income childless adults with no disability are eligible for much fewer programs, unfortunately. And the reason I removed those with disabilities out of the pool is that folks who are receiving disability do tend to receive a much richer suite of services than low-income childless adults without disabilities. For instance, 50% will receive the earned income tax credit. It's worth noting, though, that you're only eligible if you're aged 25 to 64, and you can only have a maximum of $496 per year. SNAP is also something that is limited, much more limited when you talk about low-income childless adults, and students are subject to extra rules. There's always a chance that these folks might receive housing subsidies and may receive public health insurance. It depends on, again, if you reside in Medicaid expansion states. Next slide. I'm not going to spend really any time other than one slide on this call talking about the special rules for immigrants, because they can end up being pretty complicated. Legal immigrants are disqualified from receiving many federal public benefits for 5 years after entry into the U.S. Citizen children are eligible for benefits even if their parents are undocumented. But what we find is that mixed status families, meaning the parents are undocumented, the children are citizens, they're often nervous about providing information to the government because they think that it'll end up coming back to haunt them in the form of an ICE raid or immigration getting in touch with them, even though that's the case. That is not the case. The rules are really complicated with many exceptions and qualifications. For those of you who are in high immigrant areas, I can connect you with some additional resources if need be. Now moving on to some of the programs. Next slide, please, that I'm going to cover today. These are the main public benefit programs we are referring to when we talk about public benefits, connecting your students to public benefits. They mostly include benefits that are means tested, meaning people qualify for them if they fall below a particular income level. Some of these programs, like Temporary Assistance for Needy Family or TANF, come in the form of cash, while others, like Medicaid and CHIP, the Children's Health Insurance Program, provide subsidized health insurance and are in kind. A third category come as refundable tax credits. These can be helpful to low-income students because you can get them even if you don't owe federal income taxes. Next slide, please. Now, I mentioned on an earlier slide why we have some low participation, and when I say low participation programs, I mean below 50%. The main programs I'm talking about are TANF, childcare, and housing assistance. Why is that? Again, capped funding. Childcare and housing, you have capped enrollment, and around TANF, I wanted to return to this quickly, you experience students having stigma related to cash welfare, burdensome requirements, meaning that they may be required to be working a particular number of hours or looking for a particular number of jobs, and there are time limits which restrict participation. So in talking about TANF, just want to keep that in the back of your mind. Next slide, please. And I apologize, my voice is a little scratchy. I'm suffering with we're having some allergies in Brooklyn right now. So I'm trying to drink water as I can and not sound like a scratchy record. Many people don't get what they're eligible for. We know from research that's been done, 34% of eligible parents do not receive Medicaid or CHIP, so that means they're actually eligible for subsidized health insurance and then don't receive it. 33% of eligible working families do not receive SNAP, and this varies pretty wildly across states that I'll show you later on a slide. Child care subsidies, which, as I mentioned before, are capped dollars, reach only about 30% of eligible families. And even fewer families receive continuous coverage because families churn on and off the rolls depending on if their income changes, or there's a technicality around not getting a particular foreman or that kind of thing. But the fact is very few individuals get the whole package of benefits for what they're eligible for, and participation rates vary greatly by state. Next slide, please. I'm going to start out with SNAP. That's food stamps. The Supplemental Nutrition Assistance Program is a food assistance program that provides recipients benefits that can be used to purchase groceries, but not prepared food or restaurant food. It's important to note that, or, for instance, dining hall food. Benefits are provided on an EBT card, which looks like a credit card. SNAP is a benefit that is not limited to families with children. The maximum monthly amount for a household of one is $194. For a family of three, the maximum amount is $497 a month. Most recipients get less because they have some earnings, which have implications for their benefit level. The benefit calculation takes into account earnings and sometimes particular assets. Many states no longer count assets at all, but you do run into the occasional state that counts an automobile up to a particular amount or savings, as well as expenses such as housing and child care costs get factored into it. SNAP is an entitlement program, meaning that everyone who qualifies can get it. There's not a capped amount of funding as there is in a lot of state child care programs, let's say, or housing subsidies. And so pretty much if you're eligible for SNAP, you will receive it. Also, the federal government pays the full cost of the program, so states don't bear the burden of caseload increases. Because of this, states are often more supportive of outreach efforts for SNAP than for other programs. It should be among the programs with the highest participation rates, and in the best cases states it is. But some states still have onerous application processes and recertification requirements. For instance, it was only last year that New York abolished fingerprinting as a part, New York City abolished fingerprinting as part of a requirement for SNAP receipt. There are also special eligibility rules about students who are enrolled at least half-time, which I'll talk about now. Next slide, please. Students can receive SNAP They are eligible if they meet the income and asset criteria, and any of the following apply. Caring for a child under age 6, single parent caring for a child between 6 and 11 years old and enrolled full-time or unable to obtain child care, working for pay at least 20 hours per week, so that would include work-study students as well, for anyone receiving work-study funds, and that does not have to be up to 20 hours a week. That could be a 10-hour-a-week job. Receiving TANF benefits, and being unable to work because of a disability or enrolled in certain programs aid in employment. Why there are these sort of narrow slivers of eligibility around students and SNAP is because SNAP eligibility is based on monthly income. So Congress was concerned that college students from middle-class families could qualify even though they don't need help because they have really low income, right? Therefore, most college students attending at least half-time are excluded from receiving SNAP. But there are these set of exceptions that I just went through that apply to many non-traditional and low-income community college students. Students who qualify for the exceptions are subject to the regular income and asset limits for SNAP eligibility. The most common criteria by which some students access SNAP is by working 20 hours per week, receiving work-study, or being a parent. States do have some power to expand SNAP access through policy. On the next slide, I'll talk a little bit about that. State offices that administer SNAP can define which programs are, quote, aimed at employment. These programs that are aimed at employment include services that are funded under the Workforce Investment Act, next slide, and other programs at state discretion. For instance, the 2014 Farm Bill added restrictions to what kinds of education can be claimed as SNAP E&T components. Education that is part of a program of career and technical education that may be completed in not more than 4 years in an institution of higher education, or is limited to remedial courses, basic adult ed, literacy, or ESL. In Massachusetts, advocates were able to work with their state human services agency to define programs, quote, aimed at employment based on the definition in the Perkins Act, which is the federal act that provides for vocational and technical education. The definition is broad, but more importantly, having a clear definition means that the agency that administers SNAP at the state level does not have to evaluate each college program to determine whether it is aimed at employment. This is because basically it's not the SNAP program's area of expertise to figure out which program would be eligible, but it's worth keeping in mind those programs that are aimed at employment. Next slide, moving on to health insurance. Oh, and on that prior slide, when Alyssa distributes the PowerPoint, you'll see a link to another PowerPoint that gets into much greater detail around college students and SNAP. Health insurance has obviously been something that's been in the headlines of late. Medicaid is the nation's health care program for low-income people. Low-income children and pregnant women who are eligible are likely to be enrolled, but overall, the program covers only 1 in 4 non-elderly adults. This is because eligibility for Medicaid in the past has been very limited in most states for parents and was virtually non-existent for adults who didn't have children. In the median state in 2011, parents were not eligible unless they were at 64% of the federal poverty level or below. That'd be around $14,000 for a family of 4. In most states, childless adults were not eligible. So the changes that took place under the ACA that increased the income eligibility to roughly 133% of federal poverty level, or doubled it, expanded Medicaid eligibility for you can imagine thousands and thousands of people. You might have read some of the articles about places like Kentucky that took the Medicaid expansion, and it's gotten gangbusters. As part of the Affordable Care Act, the purchase of marketplace subsidies, which you've also probably heard more about than you wanted to over the last year, starts at 100% of the federal poverty level. And young adults under 26 can now be covered by their parents' health insurance. And so that's also something that's worth making sure that everyone knows about. Next slide, please. As I mentioned, Medicaid eligibility expanded in 2014. Now, this is the case for Arkansas, California, and Washington. And even though Virginia's governor would like to expand Medicaid, he's been at loggerheads with the state legislature around that, and so that hasn't taken place. But beginning last year, many states expanded Medicaid up to 133% of the federal poverty level. That's roughly $14,484 for an individual, or $29,725 for a family of 4. And the reason it says in 2011 is because that was at what level it was pegged, at what level of the federal poverty level it was pegged down in the law. CHIP, which is the Children's Health Insurance Program, which has tended to have much higher eligibility levels, for instance, 300% of the federal poverty level, will continue at those 2009 eligibility levels, at least for a while. Next slide, please. As I mentioned, not all states have taken the expansion of Medicaid, but 28 states have expanded Medicaid. And I know that a few of you are in states that border other states, and so may have students who live in one state and go to college in another state. So it's worth noting on this map. It provides you some more context. For instance, Oregon took the expansion, and that matters for some folks in Washington State or some folks in Northern California. On to the next slide. One thing that folks have talked about is that there is a coverage gap in non-expansion states, meaning a state like Virginia that did not have the Medicaid expansion, because the state Medicaid eligibility level is maintained at the level it did before healthcare reform. And then the marketplace subsidies, which come through the federal government, come down to 100% of the federal poverty level and go up to 400% of the federal poverty level. So you can receive those subsidies at pretty broad range of income levels, but you have this gap of no coverage for those who fall between around, let's say 46% of federal poverty level and 100% of federal poverty level. And so that's why it's just really important for those states that, such as Virginia, that are not expanding Medicaid at this point, to remember that adults without children are most likely not eligible for Medicaid. Next slide. Now I'm going to talk briefly about the refundable tax credits, including the American Opportunity Tax Credit and the Earned Income Tax Credit. The AOTC is the expanded version of the HOPE credit, which you may have heard about. Many students who are in their first 4 years of post-secondary education will qualify for this refundable credit, since the income phase-out level is quite high. Partially, it's worth noting that because it is partially refundable, it's incredibly important that you connect those students who are eligible to this, because it's cold hard cash that they'll receive. They receive the credit when they fill out their taxes in the following year. And right now, the expanded version of the AOTC is due to run through 2017, but will revert to a non-refundable tax credit if Congress does not extend it past then. The AOTC covers tuition, fees, and books, but not living expenses. The maximum credit a student who is in her or his first 4 years of post-secondary education can receive up to $2,500. 40% of the credit is refundable. There are additional limitations, like the student must be pursuing an undergraduate degree or another recognized credential, but on the whole, your community college students will be eligible for the AOTC. Next slide. The Earned Income Tax Credit is a refundable tax credit. Oh, I might have skipped over. Sorry about that. The Earned Income Tax Credit is a refundable tax credit. It is the largest credit. It goes for low-income workers with children. There's a smaller credit for individuals that don't have children, but it is for people at much lower income levels, and it's much smaller, as you can see on the graph. This credit is also not available to people under the age of 24, possibly because it was not meant to include students that are not low income. Again, that issue around middle-class students looking low income because they have low earnings when they're in college. So what is low income and a large credit versus a small credit? Next slide, please. There's lots of variation, which this graph shows. It's actually a pretty hard graph to read, and it's one of those graphs that's kind of hard to read intentionally so. Families with up to one child who earn less than $38,000 in 2014 or less than $43,941 for married workers are eligible for credit of up to $3,300. Families with two children who earn less than $43,750 in 2014 or less than almost a little over $49,000 for married workers are eligible for credit up to $5,460. And families with three or more children who earn less than $46,000 in 2011 or 2014 or less than $52,427 for married workers are eligible for credit up to $6,143. So you can kind of see here at which the point an individual becomes eligible for the credit and at which point it phases out. You can see, for instance, for those who are married with 3 children, it starts to phase out in the mid-50s, as I noted. So this is a good deal of money that folks can qualify for if they are working while they're in school. Next slide, please. I always like to talk a little bit about tax help. And I didn't do a poll on this webinar, but I'm curious, I would be curious to know at some point how many of your community colleges are VITA tax sites. That means volunteer income tax, providing voluntary income tax assistance on campus. And I think it's important for all colleges, for those of you who are not doing that, to give this some thought and try to partner up with a community agency to come provide free tax assistance on campus. Many people pay a high fee for for-profit tax agencies like H&R Block, Jackson Hewitt, and others to prepare their tax returns. And those organizations or businesses take fees out of the refundable credits that are really meant to help get right back into low-income people's pockets and help them make ends meet. And so that's why I'm a big booster of colleges figuring out ways to provide free tax assistance. We've worked with some colleges that were VITA sites or other colleges that were using accounting students to provide tax assistance. And so, of course, logistics are kind of different than year-round benefits access activities because you have a high volume around a tight time frame. But usually, if you can partner up with a community resource, you'll find that they have a pretty well-oiled machine, and it'll be a great resource for your students to have there on campus. Now I'm going to turn to the family programs that are programs specifically for families with children. Next slide. These include TANF, childcare, WIC, and school lunch. Next slide. TANF, which is the Temporary Assistance for Needy Families program, provides ongoing cash assistance to very low-income parents, but benefits are low. And I like to put this graph up here because it gives you a sense of what the benefit levels are vis-a-vis the federal poverty level. You can see, for instance, in California, the maximum TANF benefits go towards family. Or if you're receiving up to, pardon me, I need to start over. If you have earnings up to 40 or 50% of the federal poverty level, you will still qualify for TANF if you live in California. Whereas if you live in Washington, what you're dealing with is a lower, even lower earnings. It's the rate between 20 to 30% of the federal poverty level and still being able to receive benefits. In a state like Arkansas, that's even lower, to between 10 to 20% of earnings of the federal poverty level and still being eligible for TANF. I'll talk a little bit more about TANF benefits in a little bit. But unfortunately, as I mentioned, the benefit amounts are very low. And in 14 states, monthly benefits are less than $300 for a family of 3 on an annual basis. So you might be asking yourself, why is she even bothering to talk about TANF? Next slide, please. And the reason I say so is because benefits can be of significant support, especially in higher benefit states like California. TANF is often a reliable gateway to child care subsidies and other public benefits. And that's another reason that it's worth, you know, I gave that example of Kentucky cutting off eligibility mid-year for those families earning less than $30,000 a year. But those families that did remain eligible for child care subsidies were TANF recipients. And so it really, I can't underscore the importance of it being a good pathway to child care subsidies. But the downside is that access to education and training is limited in many states. Depending on state policy, it may or may not support post-secondary attendance. And so it's worth keeping that in mind. Next slide. States have a lot of flexibility with TANF. They can allow people to participate in education and training for up to 12 months. And they can do that as a standalone activity, meaning solely enrolled in post-secondary, even when that's not countable toward federal work rates. They can use TANF funds to provide work-study jobs. I'm not sure if any of your states do that, but Kentucky is one state that does do that, and that's helped then TANF recipients meet the work requirement as well as meet the work requirement under SNAP. And you can seek to document hours of participation in ways that don't burden or stigmatize students. For instance, on campus, hours can be documented by an on-site case manager, the support services office. It doesn't have to be a professor, for instance. And when I'm talking about work requirement, hours requirement, documenting hours, is that there's oftentimes this requirement if you are going to post-secondary standalone that you be doing so at least 20 hours a week. And so that has to be documented. And it's not just going to school, but that also includes homework hours and that kind of thing. And so for those of you who aren't familiar with these rules, we can help hook you up with more detail around that or connect you to people in your state who will be able to do so. Next slide, please, is on child care subsidies. Center-based child care is more expensive than tuition at most public colleges. I laugh, or maybe you can hear me smiling saying that, because my son goes to previously used center-based child care, and my husband complained about how it cost more than his education at Georgia Tech over the course of 4 years. But low-income college students may be eligible for child care subsidies, which is a big deal. Post-secondary attendance is an allowable activity, meaning it allows you to be eligible for child care in 43 states and Washington, D.C., but it may require work to be in combination with that post-secondary allowable activity. So the state may require the student to attend post-secondary and hold a job 20 hours a week in order to be eligible for child care subsidies. Only about 1 in 7 eligible children are served under child care subsidy programs because there's such great shortage. And we run into a waiting list or capped enrollment in most states, unfortunately. Next slide, please. WIC is Women, Infants, and Children. It serves pregnant, postpartum, and breastfeeding women and children up to age 5. And we found, surprisingly enough, in a few of our VACC colleges that that folks didn't realize that they were eligible for WIC, and it ended up being a big help. It provides access to a lot of healthy foods. I'm sure many of you have seen the little WIC symbol in the grocery store under the box of Cheerios or under milk. States set eligibility limits, but they must be between 100 and 185% of the federal poverty level. And the student must be individually determined to be a nutrition risk by a health professional. That looks like something just happened with the slide. I'm not quite sure, but we're looking for a school lunch slide.
Yeah, sorry, my computer tried to shut down, so we should be all set now.
Okay, next slide. School lunch. Low-income families are eligible for free meals if the family income falls under 130% of the federal poverty level. Reduced price meals if the family's income falls under 185% of the federal poverty level. School lunch tends to be something that what we found and what's interesting with a lot of these benefit programs is that those who had never, let's say, are more recently unemployed or recently needy, recently experiencing a bout of poverty, don't realize the range of programs that they're eligible for, and sometimes school lunch is one of those, that it's worth asking if they have any school-age children and if they're receiving school lunch, because automatically you're eligible for free meals if any member of the family is receiving SNAP or TANF, so it's worth keeping that in mind. Eligibility is typically determined at the start of the school year, but families can apply later if circumstances change. So let's say folks get laid off from a job mid-year, they can seek an eligibility determination at that time. And then what we're also seeing is that high poverty schools or districts can qualify for universal coverage through community eligibility. That means if your area has enough folks who are low income, the entire school then will be determined eligible, and you won't have to go through individual eligibility roles. Next slide, please. So with all of these programs, unfortunately, where you live matters. And I picked two states here, Virginia and Washington, and I can, on this slide, are links to, in the notes section, the sources where you can look up the information for the other states. But we see, for instance, here between Virginia and Washington State, Virginia, the maximum monthly TANF grant for a family with no income is $320, whereas in Washington State, it's $478. The maximum monthly income for parents qualify for Medicaid in Virginia is $808, and twice that in Washington State. The maximum monthly income for a non-parent adult to qualify for Medicaid is $0 in Virginia, because Virginia did not take the Medicaid expansion under Obamacare, under the Affordable Care Act, whereas in Washington State, that non-parent can be earning up to $2,193. So that's a huge difference right there. The estimated rate of SNAP participation, I talked a little bit about that earlier, how because the feds pay 100% of the SNAP costs, most states really go after, or some states have been really ambitious about getting, ensuring that everyone who's eligible for SNAP is receiving SNAP, and we see that to be the case in Washington State, not the case in Virginia. It tends to be that the southern states do have lower participation rates in SNAP than other states. The maximum monthly income for a family to receive a child care subsidy, there's a broad range. In Virginia, as low as $2,300, and in Washington State, it's $3,200. Next slide, please. Some of you might be wondering, well, how do these public benefits interact with financial aid, because my students are receiving Pell Grants or other forms of need-based aid. Most benefits are not counted as income for the purposes of financial aid, and that's actually a federal law. Receipt of TANF, SNAP, WIC, free or reduced price school lunches, and SSI triggers a simplified expected family contribution formula, meaning that on the FAFSA there is a question that asks, do you receive one of these programs? And you want to encourage your students to answer that question truthfully. It's not a ding. It actually sends you into a much easier process to become eligible for Pell Grants, and so where assets are not considered. And so I would encourage you all to encourage your students as they complete their FAFSA to answer that question honestly. Receiving these benefits plus family income below a particular threshold, right now it's $23,000, triggers an automatic zero expected family income contribution, which means they'll qualify for the maximum Pell Grant under which they're eligible depending upon their enrollment level. Next slide, please. As I mentioned, I wouldn't be spending much time or any time on the following 5 programs, but can connect you all to resources and can guarantee you that there are probably people at your institutions who know about these programs, particularly the Workforce Investment Act or the Trade Adjustment Act. Veterans programs, increasing number of community colleges have veterans programs on campus, as well as disability programs. I'd encourage you, as you're going through your planning process, to reach out to those folks, because those folks actually do tend to have had more experience with public benefits than you might have had in the past. Next slide. Unfortunately, as we talk about all these programs, the access chain has many links. So even though a family might be eligible for SNAP, they have to know that the program exists. A student has to believe she might be eligible. She might have heard, well, students aren't eligible for SNAP, so she doesn't think she's eligible. She has to think that the benefit is worth the perceived hassle of applying, because we have to be honest, for many students, going to the welfare office in the past has entailed a several-hour wait, and that can interfere with school or with job or with taking care of children. You have to know how to apply. You have to locate and submit any needed documentation for initial eligibility or recertification. For instance, to have W-2s on hand and that sort of thing. And then you actually have to submit an application, whether that be in the office or via mail, or as I'm hoping with many of you, an online interface. And then in a future webinar, we'll talk about those different strategies that you can use to connect students to these public benefits. But as sort of a starter, we just wanted to give folks a brief overview of what the benefits are before we dive into that. And with that, I'll open up the lines for any questions.
Great. Thank you so much, Amy Ellen. That was a great overview. So if anyone has any questions, as I said at the beginning of the webinar, there are two ways you can ask questions. You can either raise your hand, and I can unmute your line, and you can talk to everyone on the webinar. Or if you're a little bit shyer or are just listening and haven't called in, you can submit your question through the question pane, and I can happily read that out loud so the whole group can hear it, and then Amy Ellen will be able to answer it for you. So our first question that's come in is, my college does not currently have a staff person that knows all the in and outs of public benefits. How do you suggest we proceed with getting up to date on relevant policy?
I think it's really important to connect with your state or local benefits agency, and that's something that you can do just on a personal level by calling up the local benefits office and describing describing this project and how you want to get involved with connecting your students to public benefits, and that you all will be doing that through the online screener or whatever the means by which you're going to do that. And would they be willing to come and talk to you about the rules? The other thing, another group that can be helpful are legal aid offices, as well as local advocacy organizations. And I'm familiar with a handful of them across the country that have done training. For instance, here in New York, the Community Service Society did training for the folks at LaGuardia Community College around public benefits, so that they could learn more about the benefits. And I know that in each of your states that you have organizations that are similar to the Community Service Society that can do that. For instance, I'm thinking about in California, the Western Center on Poverty Law, in Washington State. I'm drawing a blank right now, but I know that there are groups up there as well that do that. So either your local or state benefits office, or a local nonprofit that does work with low-income people.
Great, thank you very much. One person did ask if the PowerPoint would be available online. It is currently not available, but I will be sending it out to all of the WFSN-CC contacts, so whether someone on your team didn't join the webinar today, they will get the resource, and that will also include a recording of the webinar that's on our YouTube channel, and it'll include the cheat sheet handout that Amy Ellen has generously provided. The next question is, public benefits can be a very challenging subject for us to discuss with some of our faculty and staff. Do you have suggestions on professional development that might be helpful for these discussions?
Sure. And this is something that I know that a couple of your colleges are interested in. I'm working with a couple colleges that have done poverty simulations in the past, and have found that to be a really effective tool to help faculty and staff gain a better appreciation for what the students are going through. I also think that it's important that everyone be aware of the financial aid data that you do have, and that faculty staff have a greater understanding of the number of students, the percentage of students who are low income, and that's oftentimes been a wake-up call to them to learn that, for instance, 80% of the student body is eligible for Pell Grants. I worked with a college in Kentucky where that was the case, and that just floored the faculty and came back actually when a few of the faculty became champions of benefits access. They said finding out those figures really changed the way they looked at some things. So there are a variety of different ways that you can do that, either through data that you're collecting as part of WFSN, or, as I mentioned, a more time-intensive approach can be through doing a poverty simulation and a half-day kind of opening session or during a professional development time. But the other thing that I would say, I want to add one more thing, is that it's really important to not bombard all of your faculty with the kind of details that I gave you today, because it can seem pretty daunting. And when you're thinking about faculty, oftentimes the role that you're thinking about them and playing in some of this is a lower touch, let's say, referral. So we want them to know that if they have a conversation with June after class and she talks about how she has been saving money to pay her utility bill and so isn't eating as much, that they can then know that they need to refer her over to your office, to the folks who are doing more in-depth work around benefits access. And so a couple of the colleges that we've worked with were sort of took this more approach of like, what can you do in 30 seconds? What can you do in 1 minute? What are the questions that a faculty member could ask of a student if they come seeking help, and how can they help connect them to more resources? And so I think that's the most important thing when we think about teaching faculty, whether it be tenured or adjunct folks. And then it's very likely across your campuses you're going to find some staff and faculty that are just have more of a natural proclivity to being interested in this and being sympathetic. And I would say really empower them to become champions for this type of work then, and sort of, quote, spread the gospel amongst their peers around the importance of connecting students to public benefits.
Great, thank you. And then the last question I have so far is, are there relevant public benefits resources that you suggest the colleges read?
I can put together a resource list for you all that would be helpful for those of you who want more details, and so we can distribute that over the course of the next few days.
Okay, great. That would be very helpful. Thank you. If there are no more questions, which I encourage you to continue to ask while we have Amy Ellen on the phone, I'm just going to share some general WFSN CC updates. So our next webinar will be on October 23rd. The topic will focus on student flowcharts, and you'll have the great pleasure of hearing Amy Ellen again. So I'll be sending out the registration link for that later today. Also, be on the lookout for a technical assistance survey this week. That'll be going to the key contact at each college. And then just a polite reminder that we have received a number of signed grant agreements back. We sent the grant agreements out to all the colleges about a month ago, but we have not received all of them. I have individually followed up with each college that I haven't heard from yet, but just a polite nudge that if you haven't and you have questions or if there's language you want to further discuss, please reach out to me or Julian, or feel free to email both of us at the same time. And then, as always, just if you have any questions or if you're grappling with an issue in your implementation plan, please email us at the WFSN email. We check it regularly. We try to be very responsive. And just a reminder that we're here to help you in every stage of this work. So this will kind of be the last call for any questions. In my follow-up, I'll be sure to include Amy Ellen's email. If you are interested in having, more of an in-depth conversation with her, please CC me on that correspondence so I can be helpful in figuring out the best way that we can collaborate on this work moving forward. So if there are no more questions, I think we're going to end the webinar, and I just want to say thank you again for joining us, and a big thank you for Amy Ellen for providing this great overview, and we look forward to having her on additional webinars in the near future.
Thank you.
Have a good day. Bye.